Well, it's going to do it in stages. At the first stage, there will be 10 million healthcare workers who will be immunized. Then there will be 20 million other essential workers performing other essential functions who will be immunized. And then persons above 50 years of age, as well as persons below 50 years of age with known comorbidities would be immunized. That will be the third level of immunization, and that will be 270 million persons. So in total, we'll have about 300 million persons to be immunized in these three phases, and then it will open up to the general population.
Well, the locally developed vaccine, Covaxin, is still in clinical trials, and those being vaccinated with that have to sign consent forms, I understand?
Yes. The reason why this particular vaccine was cleared by the regulator is that the phase 3 trial is very well advanced and is due to be completed soon. But even while it was actually under the progress, there was information available that the mutant strain from UK had entered India and was increasing in terms of its infectivity. Because this is a vaccine directed against the virus through an inactivated virus and is not specifically directed only at the spike protein, but offers more antigens against which immunity can be produced. This was considered to be a potential response to any mutations that take place in the spike protein and which might make other vaccines ineffective. So the regulator decided to go ahead and give it a green signal pending the completion of the phase 3 trial. But those who are being given the vaccine are being treated essentially as people entering a trial format, but with a signed consent form and close monitoring.
Is there a preference for either of the vaccines being used?
Well, both the vaccines have been pressed into service. The other vaccine, Covishield, which has already completed its phase 3 trial, is available in larger supply, and therefore that is the more dominant vaccine in terms of the current supply chain now.
Inoculating 300 million people by July, is this really feasible? What will be some of the challenges?
Well, basically, as far as these 300 are concerned, the people who are health workers and other essential workers are clearly identified. There is really no major problem there. But the question of identifying people with comorbidities is going to be a challenge. Those who are already known to the system, it's fine. Those who are above 50 years of age are already identified. But those below 50 with comorbidities need a little closer identification and verification. The second element is to find the large number of vaccinators who can actually immunize people across the country, because our health workforce is somewhat limited in number, but many more vaccinators are being trained at the moment.
And once the general population can choose to take the vaccine or not, what will be the uptake, do you think, in India compared to countries like the US and the UK?
Well, there is no vaccine resistance or anti-vaccine campaign going on at the moment. Certainly, there is an element of hesitancy among some people because of news trickling in from abroad, both of the anti-vaccine campaigns on the social media, but also of some reports of adverse events, like, for example, the Pfizer vaccine in Norway. So people are taking their own time to make up their mind. But right now, there is no organized resistance. And as the immunization program rolls on, and if we get more comforting news from world over, that there is no major problem with the vaccine.
Professor K Srinath Reddy, we thank him very much for joining us. Thank you.
Thank you.